name is Dr. Dani Cuthbert, and I'm a medical oncologist here at St. Michael's Hospital, where I primarily treat breast cancer. Today I'll be answering some questions about breast cancer, given that it is Breast Cancer Awareness Month. All right, so our first question is, what is the breast cancer prevalence in Canada? In Canada, it's estimated that 1 in 8 women will develop breast cancer during their lifetime. The disease accounts for 25% of new cancer cases, as well as 14% of cancer-related deaths amongst Canadian women. All right, our second question is, what are some of the causes of breast cancer? So this is a really great question, and I think it's important to think about some of the causes of breast cancer as either modifiable or non-modifiable risk factors. Modifiable risk factors are those things that are somewhat within our control, and that includes things like excessive alcohol use, tobacco use, as well as leading a sedentary lifestyle, which we also know can increase our risk of developing breast cancer. In terms of non-modifiable risk factors, those are really integral to who we are and generally cannot be adjusted. So that includes things like our race and ethnicity. It also can include things like our family history and whether there's a genetic predisposition to developing the disease, such as the BRCA mutation. And also consideration of things like our underlying breast tissue and characteristics. So we know that increased density, as well as a history of having precancerous lesions, increases the risk of developing breast cancer. Not all risk factors are the same, and in general, modifiable risk factors tend to confer a smaller risk overall. Why is breast cancer rising in young people? This is another great question, and unfortunately we don't quite know the answer to this. We are seeing increased rates of cancers in younger people, and that's not exclusive to breast cancer. There certainly are a lot of studies and research underway to better understand why this is happening. I suspect there's a combination of both lifestyle and genetic factors contributing, but again, more work and research is needed to be done to fully understand why this is. Question number 4. Breast cancer and PCOS. So this question is asking about potential association between the two, and studies have actually not shown a clear link between PCOS and breast cancer. So we cannot say that individuals with PCOS have an increased risk of developing breast cancer. Our next question is about the breast cancer self-referral screening age here in Ontario, which has recently been lowered to age 40. In general, I think this is really important and a great thing for many patients to have access to screening at a younger age. I think the most important takeaway is that patients should have conversations with their healthcare providers about if and when screening makes sense for them. Part of that conversation should include not only the benefits of screening, but some of the potential harms to make the decision that's really right for you. The fact that patients are able to self-refer themselves in the province is great, so not needing a referral from your healthcare provider, I think allows for better self-advocacy and hopefully empowers a lot of patients to make the right choice for themselves. The hope is that with lowering the age, this leads to earlier detection of breast cancers so that people can ultimately do better in terms of outcomes from their disease. Okay, next question is breast cancer and how to reduce the risk of this disease. In general, leading a healthy, active lifestyle, exercising is great for reducing your risk of developing the disease. Similarly, having a healthy, balanced diet and avoiding excess weight are all wonderful things that you can do to lower your risk of developing disease. For those that are able, breastfeeding we know is also something that can reduce the risk of developing breast cancer. For those with a family history, have that conversation with your healthcare provider about if you meet eligibility criteria for genetic testing and if that's something available to you, because we know that people who have certain genetic mutations or family history of that can undergo screening at a younger age, for example, or potentially have risk-reducing procedures to lower their risk of developing breast cancer. Our next question is about breast cancer self-exam. I'll start by saying that breast self-exams are not a substitute for screening. Many studies have actually shown that there's no benefit of performing breast self-exams when it comes to lowering the risk of breast cancer diagnoses or improving people's mortality from the disease. In fact, breast self-exams lead to higher rates of biopsies for benign breast conditions. Despite that, though, I do think it's really important to be breast self-aware, know your body, so that you are able to recognize changes and bring those concerns up to your family physician in a timely manner so that they can be appropriately investigated.